My name is Claudia Cohn. I'm the Chief Medical Officer of the AABB and the Medical Director of the Blood Bank Lab at University of Minnesota. Platelets are highly used in the medical profession. There are about 3 million platelets transfused in the United States alone. And so we need to make sure that clinicians are using them appropriately, and they need experts to assemble and develop guidelines based on the available evidence. The process we use to develop the guidelines is to run an analysis of we pull together all of the papers that have been written. We assemble them so that we're comparing oranges to oranges, apples to apples, and then we grade the evidence based on whether it's high quality evidence or lower quality, high certainty, lower certainty evidence. And then we use that to develop guidelines, to make recommendations based on questions that we develop. They're called PICO questions. The important messages for physicians regarding these guidelines are that the guidelines are based on the evidence, and sometimes the evidence is better in some cases than others, have higher certainty than others. When it's high certainty evidence, we can make a strong recommendation, which means you can follow this guideline, you should follow this guideline. It is based on the best that we have available, and it is safe. We have conditional recommendations, which means the evidence isn't as strong, and you should consider this evidence, but you need to put it more in the context of the patient, the individual circumstances. It might not always be the best way to do things. These guidelines will benefit patients because patients should only receive the medications that are appropriate for their disease. And by developing evidence based on clinical trials, we know when a patient should receive a platelet and when they shouldn't. There's some cases where platelets will cause harm, and we've sussed that out with papers with clinical trials. AABB helped to develop and facilitate these guidelines by assembling the group, working with the groups that develop the evidence, putting them all together in the same room, and giving them the space to make them work and give them what they need to work together as a group. It's a formidable process. It's usually a day and a half of very friendly collegial arguments, and you need to have a good space and the support, administrative support, as well as I'd like to say that AABB carries prestige. And when the AABB says this is good, it helps the guidelines get wider recognition. I've been going to the AABB since 2008, I believe. I've gone to every one except for COVID and Hurricane Ian. So everyone that occurred, I went to. And they're wonderful meetings. We are a small but very tight community. And we come together and we learn and we play and we network. And this meeting allows us to do all three of those things. And it's a wonderful atmosphere. The key takeaways of the content for this meeting are really too diverse to say. There's basic science, there's clinical application, there's technical sessions for technologists. There's a whole range of different member types, and what the members need. And the AABB very nicely provides, I think, all of it. So the key takeaway is it's a diverse meeting for a diverse group of people who all have a common aim, and that is safe transfusion medicine, vein-to-vein transfusion medicine.